So my patient for my respiratory skill is an injectable drug user that attends a methadone clinic as part of their treatment plan for withdrawal of heroin. Upon admission to the clinic, I'm going to be testing them for TB. The patient has an induration of 5 millimeters. So the first thing I would do is check my order from my physician to make sure that I have everything correct. I would select a well-lit area for my patient. I would gather my supplies. I have my gloves, my TB syringe, my 2x2s, alcohol prep pad. I would get my vial from the refrigerator. I would check the expiration date on the vial to make sure that it's not expired. If it were new, I would put the date, today's date on it and my initials, and then I would perform hand hygiene. Next, I would enter my patient's exam room. I would introduce myself. Hello, Mrs. Smith. My name is Carrie. I'm going to be your nurse today. I'm going to be giving you your tuberculin skin test to check to see if you have TB. I'll be doing this by injecting a small amount of tuberculin under the skin of your forearm, and then you'll come back in 48 to 72 hours and have it checked. This whole process should take me about 10 minutes. Will you verify your name and date of birth for me, please? Have you ever had TB in the past or been told that you've been exposed to it or had any testing done? And do you have any allergies to latex, tape, adhesives, or medications? So TB is a disease that is caused by germs that are spread from person to person through the air. It usually affects the lungs, but it can also affect other parts of the body, such as the brain, the kidneys, and the spine. And if it's not treated, you can die from it. Some of the common symptoms of TB in the lungs is a bad cough that lasts 3 weeks or longer, pain in your chest, or coughing up blood or sputum. Do you have any questions before we get started? So I would perform hand hygiene, wash my hands. I would position my patient with their arms out, palm facing up, their elbow bent, relaxed. I would select an area on their forearm that is free from heavy hair, veins, sores or scars, or anything else that might make it hard to read later. And then once I've selected which arm and where I'm going to put the tuberculin, I would wash my hands and put on gloves. Okay, so using an alcohol wipe, I would wipe my selected area, starting at the inside, slowly moving outward, doing about a 2-inch diameter, and I would let that dry. Getting another alcohol wipe, I would wipe the top of my vial and then let that dry as well. I would get my syringe out. If it didn't already have a needle on it, I would put my needle on. So I'm going to want to take out 0.01 milliliters. So I'm going to inject that much air into my vial. Now I'm going to withdraw that much, plus a little extra. I'm going to tap to get any air bubbles out. And now I'm going to remove my extra to make sure I have all my air out. And then I have 0.01 milliliters. I would stretch the skin between my thumb and forefinger. I'm going to take my syringe with the bevel up. I'm going just under the skin at a 5 to 15 degree angle. And I want to create a 10 millimeter wheel with my solution. And I know that's not 10 millimeters, but unfortunately using this skin pad, that's probably about as good as I'm going to be able to get. I would take my needle, it would go in the sharps container. If there were any bleeding, I would take my 2x2 and lightly dab. And then I would remove my gloves and perform hand hygiene. I would then record the date, time, location of the injection site, the name of the manufacturer, the lot number, expiration of the solution, and my name on the patient's chart. I would explain to the patient that the injection site should not be scratched. They also need to keep it clean and dry. Avoid using lotions on the site and not to cover it. Don't put a Band-Aid on it. They can get it wet, but they should not scrub it. I would also explain that when they come back, we'll measure it. There may or may not be a bump. There may or may not be redness. I would remind them that they need to come back in 48 to 72 hours to have the result read. And I would give them an appointment card with my name and number and that information as well. I would make sure they didn't have any other questions, and then I would thank them for coming to the clinic. 3. So 48 to 72 hours later, my patient would return. Hi, Mrs. Smith. My name's Carrie. I'm going to be your nurse today. I'll be reading your TB test result today that you had placed the other day. This should take me about 10 minutes. Do you have any questions before we begin? Will you verify your name and date of birth for me, please? So I'm going to be using my fingers to feel the area where we injected the solution. And then I'm going to measure any raised area that we have, okay? So I'm going to perform hand hygiene. I would make sure the area that I'm using is well lit. I would have the patient place their arm firmly on the table so that I could see the area where we did the injection. Have it slightly bent, relaxed. I would lightly touch the area with pads of my fingertips, and I'm going to do a zigzag feather-like motion to palpate in both directions. I would repeat the palpitations again with the patient's arm raised at a 45-degree angle, moving my fingertips across the site. I would then use my fingertips to find the edge of the induration, and I would use my pen to mark it. And then I would go from the other side as well, not lifting up my fingertips to find where it starts. And I guess I could use it this way. And marking there. If it wasn't an even induration, I could continue doing this until I have my dots adjusted correctly so that I have the widest area from side to side. Then using a millimeter ruler, I would measure the diameter of the induration perpendicular to the long axis of the forearm. I would measure only the induration, not any redness, by placing the 0 ruler line inside the left edge of the dot and reading it to the right. I would correctly record the exact measurement in millimeters of induration on the Manitou tuberculin skin test form. It would appear that my patient has a 5 millimeter induration. I would record the date and time the test was read, my name and signature, and the presence or absence of any adverse reactions such as blistering, redness, or swelling. I would explain the significance of a positive or negative skin test to the patient. If the result is negative, that means the patient does not have a latent TB infection or TB disease. If the result is positive, it means that they were infected at some point with the TB bacteria, and more testing would be necessary to determine if they have latent TB or TB disease. Since my patient had a reading of 5 millimeters and they are an IV drug user, that would mean that they have a negative result and they would not need to have follow-up at this time. If their result had been 10 millimeters or greater, it would have been positive. I would provide documentation, a copy of the Manitou tuberculin skin test record form to the patient and explain the importance of retaining that information. I would provide culturally and linguistically appropriate educational material to the patient. And lastly, I would thank them for coming to the clinic and getting tested.